Well, welcome everyone. Welcome to Marketing 101. Hope everyone's having a good evening thus far. As you all know, Letitia's here with us, Brianna, Miwad as well. I just wanted to say that tonight's going to be a great evening. But before I begin to introduce, let me get this going. Next slide. Yes. So just a bit of acknowledgement of country. Northwest Melbourne Primary Health Network would like to acknowledge the peoples of the Kulin Nation as the traditional custodians of the land on which we're meeting today. We recognize their continuing connection to the land, waters, and culture, and would like to pay our respects to elders past, present, and emerging. So just a bit of housekeeping. All attendees are currently muted, and please keep your microphone on mute. If you had any questions, there is a question box that you can use. Feel free to chuck your questions in there. Before I forget, Brianna will be jumping off about 10-15 minutes after her presentation. So if you have any questions, technical questions for her in regards to the My Health record or electronic prescriptions or anything like that, definitely do put that in the questions box. Both her and myself will be monitoring that. In terms of questions, marketing questions for Letitia, same thing. There is a evaluation at the end of the session as well. So please fill that in. That will give us a bit of feedback on, what we should be planning next, and how we can better serve yourselves to help you guys do what you do best. This presentation component will be filmed, and then any questions will be anonymous just to protect your privacy. So by way of introduction, we have Brianna. Brianna is a provider adoption lead at the Australian Digital Health Agency. She has been around primary health care for quite a while. She's worked at various PHNs, so her understanding of this space is quite in depth. In terms of Letitia Duncan, she's the founder of LD Marketing, the one waving. She has been in the marketing space for quite a number of years, and I think her presentation will definitely reflect that. I've had a bit of a sneak peek already, and I can say that it's going to be good. It's going to be really, really good. So without further ado, let me hand over to Brianna, who will just give us a bit of an update on what's going on in the digital healthcare space, in terms of My Health record and electronic prescriptions and all that type of stuff. So Brianna, why don't you take it away?
Thanks so much, Nick. Really appreciate the intro, and it's lovely to see you all online tonight. Thanks so much for joining. As Nick said, I'll be kicking off today to just chat a little bit about the digital health tools that are available, and what we can sort of do to think about improving and growing our practices using some of these digital health tools. So bear with me for a moment while I share my correct screen with you. So today will be a really broad overview. Thanks. Today will be a really broad overview of the digital health tools that really are available for use in specialist practices, and we've seen a lot of push towards that digital health space, especially with COVID, and a lot of the events that have happened in Australia over the past couple of years. We have been really we've seen a huge growth in the amount of uptake of these digital health tools, and we have started off tonight by talking about this because it is certainly one of those topics that is or plays a huge factor in growing your practice and improving your practice. And then Letitia will take us through, obviously, the marketing side, and hopefully this will send you away tonight with some things to think about, both in the digital health space and then also in the marketing space. So let's get started. So this is a brief overview of what we aim to kind of discuss in the next 15 minutes. I'll be talking about the My Health record, as well as touching on electronic prescriptions, secure messaging, and telehealth. And we'll be giving everyone a bit of an update of where we're at with the industry offers and what's happening at the moment with specialist softwares in the space as well. So this is a bit of an illustration to kind of help us start to conceptualize the kind of digital health that we might be able to start thinking about in our own practices. Are we implementing any of this in our practice already? Is this something that we could potentially think about implementing? So My Health record may be new to some of you, and I'll touch on what that is in a moment, and how you can begin implementing that in your practice. Secure messaging is probably not something that's new to many of you. You may be interacting with a secure messaging platform by receiving results and receiving information using secure messaging, but how many of us are actually actively using secure messaging to send our information? So that's sort of something that we'll explore a little bit more as well. Telehealth, again, something that you're all probably very familiar with, and especially concerning the video conferencing side of telehealth. How can we think about utilizing digital platforms to improve patient care and improve our workflows in our practice using telehealth? And finally, electronic prescriptions. So what do you use in your practice? Have a think about whether these are tools that you actively use in your practice, and where you might want to sort of focus following the session today. So as we get started, you'll hear me, or as we move throughout today's presentation, you'll hear me referring to the Digital Health Specialist Toolkit. Now, this is a brand new website that has just been launched by the Australian Digital Health Agency, and it's resources and information around digital health tools specifically designed for specialists and specialist practices. So whether this is something that you have a look at following today's session, or you send off to the staff in your practice or your practice managers, it's a really great place to start if you're interested in getting involved and implementing some digital health tools in your practice, because there's a range of useful guides, how-to documents, videos and interviews from a range of specialists across the country that have implemented these digital health tools, and some really great sort of resources to get started and improve the way that you implement these tools in your practice. So let's start with My Health record. Now, for those of us who may not be familiar with it, what is the My Health record? First of all, we refer to it as an online summary of an individual's key health information. So what we mean by that is that it's not designed to house a complete history of a patient's health status. It's there to snapshot that key and crucial health information. And there's a range of organizations across the country that are already connected to the system. So 99% of all pharmacies in Australia are connected to the My Health record and uploading information such as dispense records for medications. 95% of all public hospitals are already connected to the system and will be able to access and upload those discharge summaries to some capacity. Some hospitals are also going beyond discharge summaries and uploading other document types as well, depending on the state and jurisdiction. We've also got 95% of all general practices connected and using the system. And we see a lot of shared health summaries, which I'll go through in a moment, which is a really great document that if you haven't looked at or come across already, I recommend opening up your patient's My Health record and looking at that. And with 95% of general practices connected and uploading those shared health summaries, it's a great way to get that top line, really crucial information on your patient's health status. We've also got about 65% of all private hospitals across the country connected and uploading, and a range of pathology and diagnostic imaging providers, as well as allied health. And now there is this focus on getting more and more specialists connected. So It is personally controlled, and the My Health record was designed so that patients have control over that record, and they are able to manage which organisations have access to the record. So 9 out of 10 Australians, or 90% of Australians, already have a My Health record, and about 89% of those records have data sitting in them. So think about 90% of your patient demographic having a My Health record, and there being data in that patient record that you may not already have access to. So it's a really great tool to support in your decision making and your clinical services that you're providing to your patient, and overall continuity and collaborative care for your patient. So we have seen improved health outcomes through the use of My Health records, certainly. It is part of a national system, so as we said, it is accessible from anywhere across Australia. A whole range of health providers across Australia are already connected to the system, and it's accessible at all times. And this is a really important one, because if a patient is needing to come to see their clinician out of hours or at emergency, or you might be seeing the patient and have very little information to go off. And this is something we hear specialists tell us a lot, that they might see a patient and not have very much to go off. The information in the referral is very little. Sometimes there's nothing in the referral at all. And so they do spend quite a lot of time digging around for information. So to be able to go into your patient's My Health record at any point in time and view that information is a really big benefit to the system. And it is protected. There is a number of security mechanisms in place that underpin the system, as well as a range of legislative requirements. So the My Health Record Rule and the My Health Record Act were pieces of legislation that were introduced to underpin the security of the system. There are penalties for the misuse of the system. So only authorised healthcare providers should be accessing their patients' My Health records. So that's a really brief overview of the system. And of course, there are whole webinars on the My Health record alone, but just to give you an idea of the kind of documents you could expect to find in your patient's My Health record, there's our shared health summaries and on the provider side. Here we can see that the shared health summary is that key document that's uploaded by general practitioners. So that gives us information like allergies, medications, diagnosis and procedures, as well as immunisation data, discharge summaries coming from hospitals, also pathology and diagnostic imaging. And those two are really important because as we know, the prevalence of duplication of testing is really, really high. So being able to go in and view those pathology and diagnostic imaging reports that were requested by providers outside of your organisation is a great way to reduce that duplication of testing that we see happening quite often. And it gives you, again, that additional clinical information that you would need to make those best decisions for your patients. A lot of medication information can also be found in the patient's My Health record. So these are our provider uploaded documents on the right, and on the left we can see our patient documents. So as we said, it is patient controlled, and we do encourage patients to add information to their own My Health record. It is really easy to tell what's uploaded by a provider and what's uploaded by the patient themselves. Things like allergies, emergency contacts, childhood development, and so on. And Medicare, because it is a national system, the Services Australia does connect to the system. So we get data such as MBS data, PBS data, as well as Australian Immunisation Register data. So this will certainly come into handy when we start to see more COVID vaccines rolling out across the country, being able to see what immunisations and vaccines your patients are having, because that AIR data is flowing into their My Health record. And of course, that MBS data, again, is one of those things that specialists are telling us is a really useful document that they can view, or data that they can view, because it tells them what services they're accessing by looking at those Medicare item numbers, and which other providers their patients are seeing and where they're going for their healthcare. So really, really useful information can be found in the My Health record. So how is this going to benefit you as a specialist practice? As you can imagine, it's a really quick and easy way to access that key health information that might not have been received directly, or you might not have requested directly. So things like those discharge summaries from hospitals, those diagnostic imaging and pathology reports, all sorts of information, lists of medications, medicines that have been discharged from pharmacies. You can really quickly and easily access that. The My Health Record is integrated into a range of clinical softwares, and some of you, if you're using Genie, for example, you might have seen the My Health Record button up on your patient's clinical files. So you are certainly able to access the My Health Record through your existing clinical software without needing to open a separate platform and going in and searching your patient's records in another platform. So I'll also provide some information following the session today where you can go and view what conformance softwares are available to see whether the software you're using is one of them, so that you can determine whether or not you are able to access in your clinical file. The other way to access My Health Record is through the National Provider Portal. So it's basically through your PROTA login. So if you have a PROTA account that you've created to access HPOS data, then you will be able to access the My Health Record through that exact same platform as well if you do not have a conformance software. So it is available certainly to access, and you just need to get set up in the system. And we'll talk a bit about that in a moment. So of course, it's got that less administrative burden in gathering that patient information and improved clinical decision making through that access to patient specific info. And as we said, the duplication of testing avoidance and access to information that can inform end-of-life care decisions as well. So advanced care plans, you might have seen as one of those options that can be uploaded by patients. So how do I get connected to My Health Record? First and foremost, contact your primary health network. So Nick, who was just on the line and introduced us and started off the session today, is doing some amazing work with specialists in connecting specialists in the Northwestern Melbourne region to My Health Record. So get in contact with your PHN. You'll receive a follow-up email today and talk to them about how you can get connected to My Health Record. Alternatively, as you saw at the beginning of my presentation, there was a link to the Digital Health Toolkit for specialists, so that website where there's all the information you could possibly need for getting connected. So we said we'd also quickly mention electronic prescriptions. So many of you may have heard of electronic prescriptions before, but basically an electronic prescription is an alternative to paper prescription. So previously, as we know, that the paper prescription that you sign has been the only legal form for a medication. But now, in addition to that paper prescription, we do have an electronic prescription, which is again another option for that legal prescription. It meets the Commonwealth, state and territory legislation across the country. They're not mandatory, they're there as an option. The whole purpose and point around creating the electronic prescription was to create patient choice and provider choice, to give you and your patients that additional choice of the kind of prescription and healthcare that would be best suited to your patients. So here we've got a bit of a slide on the evolution of prescription. So as you can see on the far left-hand side, you've got the old school prescription pad, and many of us still use that, especially when we travel rurally or we're out maybe outside of our usual general practice that we need to have prescription paper on us. So certainly something we're still seeing across the health system. The second from the left sample we've seen is a prescription that's now just printed. So you've generated it in your clinical software and you've printed it out on a electronic paper form. So now what we're seeing is less error of transcription, because instead of writing it out and the pharmacist having to decode a provider's writing, it's now really clearly visible in the printed form. Then our second from the right, so where you see a barcode on that printed form, this is where we're seeing electronic transfer of prescription. So what that means is that barcode holds a copy of that prescription information, and when it's scanned on the pharmacy end, it pre-populates all of that information into the pharmacy software. So again, it's reducing transcription error. So if the pharmacy is typing in data manually, there is an error, a margin for error. Whereas if they're scanning that barcode and it's pre-populating in their software, it's much safer because we know that that information is coming straight from the provider software to the pharmacy software, and there's going to be no sort of misunderstanding in between. And then on the far right, we have an example of the electronic prescription token. So this is our QR code, and a similar concept to ETP, so our transfer of prescription, but this time it's actually the legal form. So you don't need a paper to go along with this. You don't need to fax a paper prescription alongside the token. That token can be directly sent to your patient's phone or an email, and the pharmacy will scan that QR code and have the prescription information come up on their software. So it is the legal form of the prescription. You do not need to send any paper or fax any paper along to the pharmacy in conjunction with the electronic prescription. So you can imagine all of the benefits to electronic prescription, but some of them are that we're improving patient outcomes by reduced risk of medicine errors. Medicine misadventure has proven to be reduced through the use of electronic prescriptions. Efficiency in workflow, less paperwork. If you're doing your telehealth appointments, being able to send the electronic prescriptions because your patient's not there with you, being able to send it remotely to your patients. Same thing with your patients who may be needing repeats, being able to send that electronically after a telehealth consult will certainly improve efficiency at the practice, reducing patient misuse of prescriptions, the duplication of prescriptions as well, and improve patient medicine compliance. So secure messaging, as we said earlier on, you may be engaging with secure messaging by receiving results and receiving information, but how are you sending your information? More and more research is telling us how insecure emails can be, and as technology is improving and increasing, we are seeing emails become sort of that older, less secure way of sending data, and it can certainly be intercepted and decrypted very, very easily. So secure messaging is something that is becoming increasingly important for use in the transfer of patient data. And it is also, again, able to complement our digital health workflows. So being able to send that secure information immediately and knowing that it is sent directly to your intended recipient, and then having a receipt of that successful sending of that data is really a huge benefit of using secure messaging. And there are a range of different platforms out there, and you may already be using one, but have a think about, are you actually actively using secure messaging to send your patient information as well? And where this can improve your practice is it really shows sort of that compliance to the shift towards digital health and improve data quality and improve security of data. And it can really improve sort of the reputation of the practice and the business that you're running, and allow more and more general practitioners and other providers to refer to you as a specialist. A lot of the time we hear that providers are looking for specialists who utilize secure messaging, and that's where they'll create those relationships and start to refer off to specialists. So if you're sort of a newer practice and you're looking to increase the amount of referrals you're getting in, think about utilizing secure messaging more accurately. And finally, telehealth. So telehealth, many of you are going to be really familiar with and are probably already utilizing in some way, shape or form. And we know the benefits of telehealth, as you can see on your screen. But what is really useful to think about is, am I using telehealth in conjunction with those inpatient visits where I can? Am I combining the two? Obviously, a lot of research and information tells us that telehealth is there to be used in partnership with our in-person patient support, and that we don't want to see a shift towards telehealth. We want to see good healthcare, and part of good healthcare and improved healthcare for you and your patients may be using telehealth to some degree, and it's up to you to determine what that workflow looks like and what that distribution of telehealth and in-person appointments looks like for your practice. But think about also how telehealth could tie together with all of these digital health tools that we've spoken about already. So accessing My Health Record before the telehealth consult to get that crucial health data for your patient and get a really good understanding of your patient's health status through their health data that you can see in their My Health Record. You could access it before, during, or after the telehealth consult. Let's say after the telehealth consult, the patient needs an electronic prescription. You can send that electronic prescription directly to their mobile phone. And while you're on the call with the patient, they can confirm, yes, I've received that prescription. I'll go fill it at the pharmacy after this, or whatever it may be. And then following that consultation as well, you might then send a letter to the patient's GP or other providers in that patient's healthcare team through secure messaging, and know that it is arrived in the intended destination within a matter of minutes. So these are the kind of workflows that we are here to support you with here at the Australian Digital Health Agency, and it's really all about creating better, streamlined and more efficient workflows at your practice and better outcomes for your patient, and really highlighting the security of that health data as well. So to finish off my section, I'll give you a brief update on the softwares that are happening at the agency, and just pointing you back to the specialist toolkit. So it's really easy to jump onto the website. It's just specialist-toolkit at digitalhealth.gov.au. If you just type in Digital Health Agency Specialist Toolkit, you'll find it in Google as well. And this is where you've got a range of information that can support you with all of the tools that we've mentioned today. Finally, the specialist software industry offer. So as I mentioned, the agency is working really closely with a range of specialist softwares or software vendors who are completing designs that will allow seamless and secure integration of the My Health Record into those current clinical information systems. So this project is due to be complete towards the middle or end of this year. So we're looking at about June, July at this point. And it is sort of a dynamic project and with a lot of moving parts, but there are a range of vendors that we are in partnership with to try and improve the access to My Health Record and electronic prescribing as well by working with them. So keep your eye out and have a chat to Nick and the team as well if you want a little bit more information about your software and how to connect to these digital health tools. So I'll leave it there for tonight. Thank you for your attention and questions when we've had this chat about digital health. If we've got some time, Nick, I'm happy to answer some questions now, or if you'd like to jump straight into the Marketing 101, I can answer those questions individually.
I reckon we should jump into Marketing 101. I think everyone's quite excited as well to hear what Letitia has to say. I am too, actually.
Yeah, certainly. I'll answer those questions offline. Thanks so much, everyone.
Thanks, Brianna.
Amazing. Well, over to me. Hi, everybody. I'm Letitia. Thanks for coming along tonight. I'm going to dive straight into my presentation. I will just check that Nick, just let me know if there's any issues with the slides coming up. It looks good at my end. Perfect.
Looks good on my end. Yep.
Very good. Well, I will dive straight in there. Don't forget, if you have questions throughout my presentation, as I'm going along, type them into the questions section, and we'll get a chance to go through those at the end. So before we deep dive into the digital platforms to help market your business electronically and via digital channels, I thought it would be good to just quickly set the scene. Because obviously we've had, off the back of 2020, it was a year like no other. And if your audience wasn't online before last year, they are now. So last year was like a crash course in getting up to speed on digital channels. And we did see retail experiencing 5 years of e-commerce growth in just 6 months during the pandemic. From online shopping, click and collect purchases, online reservations and bookings, consumer expectations have shifted significantly in this space, and we've seen a lot of fast movers in this space that have set the scene and set the benchmark for the rest of us to follow. It's fair to say that after the lockdown section, particularly for people living in Melbourne, these changes to their consumer behaviour that they had during that time, particularly in the digital space, are going to have a lasting impact on their purchase methods in future. In particular, we saw a significant increase in the confidence that consumers had in digital payment options, both online and offline. Before last year, this was a barrier for some of your audience. It would have been a barrier for them to really embrace these channels, but that barrier really doesn't exist anymore. There might be a few that still are hesitant to really embrace it, but for the most part, digital is continuing to be a preferred channel, even now that people can go into shopping centres and can go and do their purchases in person. We are seeing a bit of a multi-channel approach, which I'll get to in a sec. As with previous years, video is still outperforming other content on digital platforms, and it's getting the largest share of consumer attention. So that will be really important for the coming year. And as I mentioned just before, these multi-channel experiences and the importance of them is rising, where clients are using both digital and physical platforms to engage either services or purchases. So example there would be click and collect for products and online reservations and bookings for services. We're also seeing that in the past year, there has been trust has been eroded, and building trust and relationships with your clients is going to be more important than ever. This is already a space where you needed to be in terms of developing a good trusting relationship with your clients, where they know, like and trust you, but this is going to be even more important at the moment. And the source there for this, if you did want to dive any further into how consumer behaviour has changed in the past year, I'd encourage you to have a look at KPMG's Australian Retail Outlook. That's up on their website. It's a useful tool. I do include a link, so following the presentation you will get a downloadable document that has some guides and some steps for your digital marketing, and I have included a link to KPMG's report in there. So this is just an example of a multi-channel delivery in the medical space. You can see that the first option is where a client has seen a social media post on their mobile phone from a clinic, and they've had a digital experience there. They've seen the post, it's prompted a thought in their brain, oh yeah, this is I've been putting that appointment off. Then later in the day, while they're out driving, they see a sign for your clinic. Once again, prompting, bringing you to front of mind. Following that, they book an appointment on their mobile device online and attend your clinic later in the week. So this is just an example of consumers going seamlessly between digital and physical delivery channels, and that increasingly is the expectation from consumers, that they will be able to do part of their transactions in a digital space. Before I go through all of the marketing and the bells and whistles side of it, I do want to keep you safe. So I thought it would be appropriate to acknowledge APRA's advertising guidelines. If you haven't recently checked out the Advertising Hub, I strongly encourage you to do so. I definitely encourage you to do so if you're about to start some new marketing or communications and you haven't been on there recently. And I've got just a screenshot of their homepage of the Advertising Hub. It's got lots of information in there to make sure that you keep in line with the guidelines. In particular, the frequently asked questions section is particularly useful. So I encourage you to check that out. I have included just a few areas that to be careful in that particularly stand out for tonight's presentation. The first is using the term specialising or specialist. Obviously that has a technical meaning, so you need to be careful that you're in keeping with the guidelines as to how to use that. Also, testimonials and reviews. This is another area that's particularly popular in digital spaces, to include client testimonials. From a medical perspective, you need to be sure that you're not including details around symptoms, diagnosis, treatment or outcomes, because that can get you into trouble with APRA. And I do go into this a little bit further on in the presentation as well. In regard to referencing treatment of health conditions, just making sure that you meet the acceptable evidence requirements there. Likewise with using personal experiences or anecdotes or discounts or gifts or inducement, they're all areas to be particularly careful and are mentioned in the APRA guidelines as areas for concern. Likewise, encouraging regular or unnecessary use of health services is another area to be very careful in. So now that we've covered that off, and do go and check out APRA's Advertising Hub, we can dive into the steps to market your business using digital platforms. Now, tonight I'm going to cover 7 steps to help get your business up to speed in this space. What I hope it will help you to do is to create a bigger picture and a more strategic approach to your digital marketing and online marketing. Instead of feeling compelled to jump from one trend to the next, you'll have the bigger picture of all of the channels and options available to you, and a guideline as to which order to do them in. At the end of tonight's presentation, I'll also include some steps to help you to take your digital approach to the next level, and I'll share with you some do-it-yourself tools that you can use to help get you there. So, step 1. Step 1's all about knowing your ideal client. And these are the ones that you wish you could clone them and just keep serving them again and again. Now, knowing your ideal client is not just important in the digital space. This is important in all of the traditional marketing and communication channels as well. You really want to get deep dive into your client to work out what makes them tick. Because if you try to market to everybody, you'll end up attracting nobody, and we don't want that. We want you to be successful. So when you're thinking about your ideal client, you really want to start thinking about what are their needs, what are their wants, and what are their pain points. So those are the things that are going to keep them up at night, that they really a struggle for them. And then use this information to inspire all of your marketing and communications approach. It should really all be about them. So when you're thinking about your ideal client, a useful place to start is to have a look at your current client database and what information you already have on them, so that you can start to build, if you haven't quite nailed what who your ideal client is, have a look at your existing client base and think about where have you got a particular strength. Are there patterns that you can that can inspire you to really hone in on who you are best able to serve. And I've now got a couple of examples of some medical providers who are using their ideal clients to inspire their marketing approach. So the first example is the Women's Health Hub, who are in Melbourne's West, so in our hood. This is just a screen grab of their Instagram page, and you can see right from the outset in their description, they're calling out that they're all about women's health. Their name pretty much says they're all about women's health. And likewise in their colours, the images, the topics and the content that they're posting on their Instagram account, it's all inspired by their ideal client. So, so a bit of an extreme example, because obviously they are very extremely focused on a particular gender. So I've included another example of a general practice who quite clearly are targeting people who are after a holistic approach to their healthcare needs. So they're using that inspiration of clients who want a general practice that can cover all of their health and well-being needs, and they're using that to inspire the colours that they're using on the website, the imagery that they're using, the text, and even the layout. It has a very very holistic feel to it. So they're just two good examples of how you might choose to let your ideal client inspire what you do, both on Instagram and on website in those two examples. So you've nailed who your ideal client is. It's time to now, step 2 is about getting your website working harder. So I want you to think about your website in the same way that you think about your physical location. Your website is like your digital home. So just like your physical location or your clinic or wherever you deliver your services, it needs some cleaning, it needs some maintenance. It definitely needs an update from time to time. Your website is no different. It needs a bit of love and a bit of housekeeping from time to time. So with that in mind, I'm going to ask Nick to activate. We've got 2 polls for tonight's presentation. So this is where you get to give me some feedback and the rest of the participants a bit of insight into how you're currently managing your website. So that should have popped up on your screen now. So I'll give you a few moments to complete that. Okay, I can see quite a few of you have already, well, in fact, most of you have already completed that. So Nick, when you have a sec, I might get you to just share the results of that poll up on the screen. And excuse me, looking between the 2 different screens here. Okay, so we can see that most of you have a team member who makes the changes on your behalf. The next most popular is using an external developer or communications consultant to update your website with a fewer amount only making the changes themselves and a very small percentage not regularly updating their website. I don't encourage that, but hopefully tonight's presentation will inspire you to make a move with keeping your website up to date. So I think, let me just see, Nick, do you want to just let me know if it's gone back to sharing my screen?
Yep, all good. Yep,
Perfect.
can definitely see
Thank
you
you.
and your presentation. No problem.
Amazing, thank you. Okay, so getting your website working harder. No surprise that that I'm going to tell you the first up. It's not about you. It's about your ideal client. It's going to be a theme throughout tonight's presentation. So what you want to do is communicate your services using their language. Imagine that you're in your clinic face to face with your ideal client. How would you explain your services to them? And then using that conversational, their language tone and reflecting that on your website. And I find it's really helpful to flip what would be features of your services and the services and products that you might provide, and flipping them into benefits that respond to your ideal clients' needs, wants, and pain points. It's going to be far more appealing and draw them in a lot further if you're connecting the dots for them. If you're connecting, this is your problem or your pain point, this is how my services address that pain point. So it just makes it abundantly clear. Another element to think about with your website, no surprise, is it easy to use and well laid out? So can people, your ideal clients, hopefully, can they navigate easily throughout your website? Does it make sense? And are the call to actions clear? And by call to actions, I mean the actions that you want your ideal client to take. So that might be join a wait list. It might be book online now, call now. Whatever it is for your clinic or services, you want to make sure that your website has it clear and there are multiple ways that they can navigate to the call to action. And also having a think about, you know, back to the functionality of your website and what you can do within your website to make it easier for your clients to choose you. Because if you, the more barriers that are in place that they have to jump over to make that appointment or make that call, the less likely they are to do so. So having a think about what you can do in terms of functionality to help them to choose you. Now, I've got a couple of examples to share with you. The first one I'm going to share, I particularly wanted to share because of the photographs and the videos that are included in it. So I'll jump on into the next slide. So this is the Eleanor Clinic, which is located in West Footscray, and I particularly wanted to point out that they're using imagery of not just their team members, but also of their clinic. So their patient rooms, their wait list. This is really, really helpful in terms of getting your ideal clients to know, like, and trust you. It's very authentic. You can see that that the images in this example, you know, they are they're not highly photo touched or stylized. It's showing the clinic in a very approachable manner, and that can really help with that relationship building. It's also really helpful for clients that perhaps suffer from anxiety or really need to to feel comfortable before they will make an appointment. So this can be really helpful in removing barriers for people who might otherwise be hesitant to make a booking with a new clinic. The other element to consider with photographs and videos on your website is that search engines preference them, and so you will rank more highly in search results, particularly for video. And the next example I've got for you tonight is of a skincare clinic. And this is just one where it demonstrates them, and I've just taken a screen grab from part of their website, where they're really unpacking what you can expect from their services and reducing some of the barriers once again, so that if people know before they attend your clinic that this is what you can expect from an appointment with us. And bonus points for the second two images, which are images from that actual clinic itself. I think the other one's a stock shot, pretty sure it is, but the other images are once again helping to build that know, like and trust component. And once again, brilliant for people that perhaps suffer from anxiety or other or have other concerns about what the service might be. And this last example is from London. So I wanted to include, I guess, something to inspire you in terms of how what you can do at the extreme end of your website in terms of digital functionality and approach. So I acknowledge this is an overseas example, so they're in a different market, different regulations, different conditions. But in this example, there are some take homes. So in particular, right in the middle, you've got a very clear call to action for making an appointment, either online or in person. You've then got further down in the body of the home page, you've got all of their digital options, which are then reinforced with little infographics that add meaning to the text beneath them. So they're not just there to look pretty; they actually reinforce what is said in the text below it. There's also within the top navigation of this website, there's book a clinic appointment. So, that's 3 options all within the one home screen of how you can book an appointment with this clinic. Their phone number is also there very prominently, and the bonus points because they've got a for patients version of their website, and then at the top there's you can click on and get a business customer view of their website. So just an example of where you might like to take your website in the future. So step 3, we've got our ideal client completely figured out. We've got our website working a bit harder for us. Next thing is to get your email database and leverage that. So this is a really, really helpful and economical way for you to have stay connected and stay engaged with your ideal clients. It's not relying on you appearing in their news feed on their social channels. It's not relying on them seeing your billboards or any other form of promotion. It's going directly into their inbox. And can really help build that know, like and trust factor with your ideal clients. Now, most of you have already got ways that you collect client and patient email addresses. I'd just encourage you to have a think about, are you doing that to the greatest extent that you can? Are there missed opportunities for you to grab email addresses so that you can market and communicate and engage with your clients on an ongoing basis? I also talk about segmenting in this bullet point. So that is grouping your clients into logical client groupings. So you might have a grouping for people with young children. You might have a grouping for people who are interested in holistic health, and so on. You get the picture. So the next thing to consider is how to use your email database. And I've got a couple of examples here that I think are good examples of really purposeful and engaging ways to use email lists. So the first one is Complete Skin Specialists in Sunbury. So they've used email to send out this recent email alert to their clients, letting them know that they've got 2 new dermatologists in their practice. They've then related it back to the client, the ideal customer, and have talked about, so if you've been on our waiting list, or you need to make an appointment, now is a really good time to call, because they've just opened up a whole lot of new appointments, and their capacity is even greater within the clinic now. And you can see in the middle of that email, they've included a really prominent book now button there, with encouraging that call to action, which is very, very helpful, and obviously good for their clinic. Another thing I wanted to point out with this email is that they're using their own photographs in there, which is once again helping that build that know, like, and trust component. I particularly like that they've used full colour photos for the photos that they've included, partially because I know black and white can seem very aesthetically pleasing and stylised. However, in terms of that know, like, and trust factor, it's a 1%er, but it does improve, having a full colour image does improve the perception of a relationship. So it is, once again, it's just those 1%ers sometimes that can make a difference. So that's a good example there. And I've got another example of, this one's an e-newsletter that is sent quarterly by Complete Children's Health. They're in Moonee Ponds and Keilor Village. They've included this to talk about topical things that are happening at the moment, both in their clinic and in the broader community, as it relates to their clinic. And they've used it as a great way of staying engaged and connected with their ideal clients. So you can see that they've also used their photographs in there. Highly encourage you to do this. And yeah, it just helps to know, like, and trust, and keeping you front of mind, so that when your ideal clients do have needs, that they think of you first. So we're up to step 4. We've got your ideal client sorted out. You've got your website working harder. You've got your email database working for you. Now it's time to improve your ranking in online search. Now, before I deep dive into this, I will just include some screen grabs so that we can all make sure we're on the same page in terms of the terminology used for online search. So we've got the search area up the top there, and in this example, I've searched the term sleep specialist. You then have the middle area, which is the map-based results, which are the Google My Business results, and I'll talk about those in a bit further detail in the next step. And then at the bottom there, you've got the natural search results as they've come up for this search term. Now I've got one more example, which is just when I searched podiatrist from my location. Here's the paid search results that come up. So these are ones where the clinics have paid to have their search, a little advert about their website and their clinic come up on the results. And you can see on the left-hand side of each of those results, there's the term ad in bold. So that's how you identify that it's a paid result. So now that we're all, and I'm sure you've all used search a million times, but just good to sort of clarify that from the outset. So let's get you improving your ranking in online search. Now, in this one, I strongly encourage you to have a look back again at your website and some of those website basics that do impact your ranking in online search. So these include, is it easy to use and navigate? Because it not only makes it easy to use and navigate for your clients, but it also makes it easy for the Google search bot to go through your website and make sense of it and rank it in the correct way. The next one is it secure? So does it have an SSL certificate? And they're the little padlocks that you see at the top when you type in a URL. The padlock that comes up confirms that the website that you're going to is a secure website, and Google wants to protect its users. It wants them to love them and keep coming back, and so definitely does seek to keep them safe through ranking more highly websites that are secure. It also makes a difference whether it's mobile friendly, and so that means whether I'm looking at it from my desktop or whether I'm looking at it on my mobile phone or other device, that the website responds to the different design layouts of the two screens. And the other element of web basics that impacts it is the download speed. So this is how quickly, when someone clicks on your website or types in your URL, it's how quickly your website loads in comparison to other websites. So there are some factors that impact your download speed. That includes the things like your images, whether they've been optimized for the web and load quite quickly. Also things like your the code that's used to build your website, whether it's using out-of-date code or excessively complicated code, or has some bells and whistles that are negatively impacting how quickly the site loads. So bells and whistles are good things as long as they add to the user experience. But if they're not adding to the user experience, the odds are they will be impacting the speed in which your website downloads. So always think about those components when you're incorporating a new bell or whistle. Now, in terms of how you can assess whether your website basics are in good order, there's a couple of tools you can use. You can go to Google's Search Console and check how your website is performing in search. And you can also go to Google Analytics and set up an analytics site if you haven't already for your website. That will help you to help inform you about the performance of your website. It will come up with recommendations. It will show how these elements are performing on your website. So I know from the poll that a lot of you have a team member that does this. So it would be a matter of sitting down with them and setting up a Google Analytics page and going and nutting out the Google Search Console results as well. If you're using an external developer, they should be able to, or a comms consultant, they should be able to step you through this process to work out how your website's performance is going. So, in addition to the basics of your website, the content on your website also makes a difference as to how your site will appear in search results. So, is it well written? So things like spelling mistakes or grammatical errors can actually damage how your site is ranking in online search. So they're not just a good thing in terms of having a professional approach. They are really important when it comes to your ranking as well. Google perceives websites with spelling errors and grammatical errors as less reliable than other websites and penalises them for that in the ranking. Do you use terms that your clients will use when they're searching for your services in an online search? And having a look if you're using them in both your headings and in your text, because Google essentially will look at one of the main factors in determining whether your website and where your website ranks in online search is whether the content on your website is actually relevant to the search that's being undertaken. So it is important to pepper your website with the search terms that your clients will be using. Also, another component for which not only helps the functionality of your website, but also helps the Google search bot is to include internal links also in the body of your website. So it just helps your ideal client and the search bot to move easily around your website. So not just relying on the top navigation to help your clients move through it, actually having links to other pages within your site in the main body of your website. Good from a user experience perspective, and also good for the search bot and your search ranking. Now I've got a few more ones. Is the call to action clear? This one I know we've covered in the past. This also helps with online, with your ranking in online search. And a few more, including video on your site where possible. The algorithm favours video because consumers favour videos. So if you're able to include it, I strongly encourage you to do so. The other couple of elements that impact it is looking for opportunities for other websites to link to your website. So a really easy way of doing this is getting online search directories like Health Direct, like Yellow Pages, True Local, Yelp, Hot Frog, and other. You might have a local website that lists service providers in their area. Even your local council might have a community directory on there. These are all great examples of ways to get other websites to link back to your website. Now that's good as a good practice in general for getting traffic to your website, but it also sends a message to the Google search bot, or the Google search bot perceives that as a reliability and accuracy tick for your website. So it's going to then consider that your website is one that they can be safe and relevant to send people searching to your website. Another example is to link to external websites where relevant as well. This actually improves your search ranking. Also, it positions you as an active and reliable member of the online community, if you like. And examples of where it might be relevant for you to do this is having a link to the Cancer Council or support services like Beyond Blue and Lifeline. So these are really good examples of where you might choose to include links, and it also helps to back up the content that you're putting on your website. Just a reminder, particularly with directory services, if wherever you describe your services, it's important to keep it consistent. This does impact your ranking as well, so be sure to include the name of your clinic and or your name, your address, and your profile, and keeping that a consistent formula. You might have it saved in key documents somewhere where you just cut and paste it every time you're doing a listing, so that you're keeping it consistent and getting the rankings working in your favour. So we're up to step 5, and this is where we double back to the Google My Business results and improving your Google My Business page. Now, this, hopefully you know what I'm talking about, but if you don't, it's these map-based results that come up when you're doing an online search. So there, each of those listings is known as a Google My Business page. So how do you improve it? There's 3 factors that impact how you rank on Google My Business results. The first is how relevant your page and your website is to the search term that's being looked up, what your locational proximity is in relation to the person searching or the area that they're searching in. And the third one is the prominence of your page and of your website. So that's, once again, how complete your page is, whether you've got links, internal and external links happening. So that's how Google decides what to show in that and the order in which to show them in those results. So if you haven't done so already, I highly encourage you to claim and set up your Google My Business page. If you've already got your Google My Business page, now's a good time to, just a little prompter for you to go in and have a look at your page and make sure that it includes all of the information that you have about your business. I highly encourage you. It's quite easy to fill out. It's Google have done a great job to make it very user-friendly. So wherever there's a field with information to put it in, I highly encourage you to fill in that field, because the more information you include, the higher you will rank. The other component with this is, obviously, for businesses with a physical location, the Google My Business results come up extremely prominently on search results. So it makes sense for you to be paying attention to this space and for you to be making the most of it. So I've got a couple of screenshots that just sort of talk you through the Google My Business pages. So in this example, I've searched for the term podiatrist and I've clicked on the Google My Business result for sole podiatry. In this, you can see that they've got their address, they've got their hours, they've got their phone number, a link to online appointments. They've included photos of the external and internal of their clinic. I've got another example here of the Glenroy Foot Clinic, and in this example, they've leveraged the updates option. In this one, they've done a COVID-19 update, but you can also do general business updates as well. Say if there was a new person in your clinic, a new doctor, a new reception staff, you can use this update functionality to introduce them to your audience. You can also use it, say, for example, a really practical example of using it is if there's an upcoming public holiday, you can include emergency contact details or what your clinic hours are during that time. And I'm just going to go back to Sole Podiatry and go on to their review section, which is at the bottom. So if you scroll down on their Google My Business page, the reviews would come up on the screen. And this is where I just wanted to reflag the APRA advertising guidelines. So those the bottom search, the bottom review in particular is talking about that the staff are amazing and that they're really good with children and highly recommend it. That sort of information. Likewise with information or reviews that talk about the layout of your clinic. They might say, oh, they've got a fantastic kids area, or lots of magazines in the foyer, or the reception staff are always so friendly and helpful. All of those types of reviews are more than a-okay to include on your reviews. But with your Google My Business page, you do have the functionality to be able to delete reviews. So if you find a review that goes into detail about symptoms, treatment, a diagnosis, all of those factors that APRA guidelines frown upon, you can go in and delete it and just respond to them directly to say, thank you very much, but APRA requires me to take it down. So I know some providers feel particularly nervous about the Google review functionality, and that they're right to be nervous, but there are ways to keep yourself safe in that space. The next step is sorting out your socials. So this is where one of the main questions I get asked about in this channel is, what channels should you use? And the answer, it won't surprise you, it might be a little bit annoying, but it's the ones your clients are on, of course. So I do give you some other tips in relation to this, but just for example, if you're looking at a business audience, you might like to go on LinkedIn if they're a professional business that has a presence on LinkedIn. Go on there. So you can always 100%, you can, if you've got particular clients that you have a strong rapport with, you can ask them. You could do a little mini poll within your own clinic. You can always also check out Census, the social media report, and they give some indications as to the most popular social media channels and the demographics that are on each of the channels. From a high level, Facebook and Instagram are a pretty good space to start. Both of them are very highly saturated in the Australian market with lots of people signed up to those. So I'm going to show, so once you've worked out what channel that you're going to use and focus on, or channels for your social media, you then need to consider what to put on there. So here's an example of a psychologist, so Deirdre Bradner Psychology. She set up a business profile for her clinic. It includes a bio or a description. This is I should mention, this is a screenshot of her Instagram account where she's got a description of who she serves. So her ideal clients are parents of children and adolescents that she works with. She also does professional speaking and school presentations, and she's included a link to her website there as a little bit.ly link, a shortened URL link. So in the actual, once you've actually set up your site, popped your logo and or your photo on as your profile image, you want to have a look at the content that you're posting. So on Deirdre's, you can see that she's posting a mixture of text-based sort of meme style posts and also videos. So once again, I've mentioned this previously, but social media algorithms favour videos. So this is a really good method to use to communicate on social media channels. And she's also included, her mem posts are all about advice on how to deal with current issues happening. So she's got how to talk with your child about the latest lockdown on there. They're all posts that are generally trying to provide value to her ideal client. Because social media, it is a two-way environment where you want to develop a relationship and hopefully get your ideal clients to know, like, and trust you, and then have you be front of mind when they do need your services. So I've got a couple of other examples here as well. This next example is of a skincare clinic where they have done the classic before and after photo with sunburn. In this, the reason I wanted to include this post isn't so much about the content of the post itself. It's more demonstrating that they've had one of their followers comment on the post, and they've responded to that comment. So they've liked the comment that the follower has put on there, and then they've responded to it. So I often get people coming up to me or approaching me and talking about, I feel like I'm doing all of the right things on social media. I'm pushing out lots of content, but I just don't seem to be getting engagement or getting a lot of traction with my posts. And more often than not, when I look at their social media accounts, they're using them like a broadcasting tool. This is not what social media is about. It's like a community, it's having a conversation. So the engagement is two-way. If you find yourself just posting and pushing out content, your results really aren't going to be what they could be. All it takes is just a little bit of interaction. You'll see in this example that they've done a very small comment. That was all it needed, but it makes a big difference in terms of the know, like and trust factor, but it also really helps to get the algorithms in social media working in your favour, because they're seeing you as a valuable contributor to their channel. I've now got another example, which, apologies, another skin-related example. This is once again Complete Skincare skin specialists in Sunbury. They've included a before and after shot where they've then in the comments of the post, they've mentioned their IPL services and how that can help with sunspots and sun damage and aging related to that. So that's just an example to show, yes, I highly encourage you to post value-added content on there, but from time to time, it's perfectly okay to put a more targeted post about a service you provide or introducing a new member of the team at your clinic or the like. So then that's all on social media for now. The next step I wanted to talk with you is about amplifying your efforts. So once you've leveraged the other methods, that's when I would encourage you to consider using paid digital advertising to increase your reach and the scale of your marketing approach in the online environment. The first place to start, in my view, is with Google AdWords. So this is where you're bidding for your website, a little blurb about your website or an advert about your website to appear on specific search terms. So it might be podiatrist, and you then narrow it down to a particular geographical location, and you can also narrow it down by demographic. So you might have that to match your ideal customer. And one of the benefits of AdWords is that you're capturing ideal clients at the moment that they're actively searching for your services. So this is a really good place to start and can be quite, there's a low barrier to entry in terms of it doesn't cost that much to dip your toe in the water and have a bit of a go at digital advertising on Google AdWords. The next, once you've had a go at that, you could also boost your social media posts. So getting them, not just relying on where they naturally fall in your ideal clients' news feeds, but boosting them so that they appear in more people's news feeds and extending that reach a bit further. But once again, I highly encourage you this will only amplify what you're doing. So if you haven't followed the 6 steps before this, you the results that you will get in these environments won't be as good as they could be, because it amplifies it. So it can only amplify what you've currently got in terms of your digital home, which is your website, and how you're using your digital presence, both in the search space and in social media channels. So that's the end of the steps. I've now got just a couple of next level considerations, which I know we're going a bit over, so I'll just quickly zoom through. If you have questions on them, we can cover them off at the end, but I'm conscious that many of you might need to go soon, so I will cover this. So next level, I've got here geotagging images. So geotagging is the code that sits behind your photographs and videos that links it to a particular physical location. So I've got a tool there where you can check what the geotag is for a particular image, and override that with your own physical location if you want. And the reason I mention tagging your photos with a location in the code in the background is that this will help how your this adds to that ranking in online search. So and picks up the proximity of your photos to the search, to the person searching. The next one is taking video to the next level on social media by doing live video. The algorithms love this, so it's a great way of reaching a wider audience. You could also, so search engine, I've got SEO there, that's search engine optimization. This is one of those topics that you could talk about all night, and we certainly could, and well into tomorrow and the next day. So there is a lot more that you could do in this space if you want to have a look in it from a do-it-yourself perspective. If you want to have a look into it a bit further, just included this link to screamingfrog.co.uk/SEO Spider, SEO Spider, I'm trying to rush it, apologies, that can help you to further your journey in search engine optimization. The next one is also related to search engine optimizing, and it's talking about the meta descriptions. So these are the code that is used to help search engines to understand a page. So every page on your website will have a meta title and a meta description. I've got an example here of Kensington Healthcare. So their homepage example, the meta title is Kensington Healthcare. The meta description is underneath it. So I would, for those of you that are working with an external consultant, they can help you to refine and tweak this. For those of you that aren't, search your business name, have a look at what's coming up. If you're not happy with the description that is currently there, then I'd encourage you to investigate in your content management system on your website for overriding that summary and changing it to something that you feel better positions your clinic. And the last one is in relation to Google Ads, doing A/B testing. So that's where you might change one element like the heading and run a test on how that performs, how the two perform against each other, and using that to inform your future marketing approach. I promised that I would share some do-it-yourself tools. So here they are. I've got Canva there. It's a great tool for making professional looking templates for your social media posts so that your branding, it really pops and people don't confuse your posts for your competitors' posts. I also use InShot. This is a great app for editing video, on particularly for use on social media. Once again, on the video theme, for those, this is Clip-O-Matic. It's an app that can auto-generate video captions for your videos, which will make it significantly more accessible, and also works for those people that don't necessarily want sound on when they're viewing your content. Later, this is an app Later that has both an online and an app-based tool for managing and scheduling content. So this is really great for your social media channels if you're wanting to batch content, which I think it's 2 thumbs up on batching content from my perspective. This is a tool that can help you to do that, to predetermine the date and time that a post appears and have it all created in the one app. It's very very handy and good from a time management perspective. Just a quick note on that: if you are posting on Facebook, Facebook has its own scheduling option which it preferences. So if you're wanting to batch and schedule Facebook posts, I encourage you to do it on Facebook's tool. And the last one is Asana. So this is a project management tool. It's both app and online based. I find it very helpful for my content calendar and for capturing social media ideas. I find that often when I'm out and about, I might be out for a walk or doing something else, I think of the best content ideas. With Asana, all I need to do is click on the app, type it in on my mobile, and I've got it captured there for when I'm next doing my batching. So this is a helpful tool. You can add all of if you've got multiple people in your team that do your social media posting, you can delegate things, you can add them so that you're all looking at the one content calendar and ideas spreadsheet. Another one of those is Trello, which is also quite popular. And this slide is just to encourage you in terms of another tool that you can use for your digital marketing is the humble tripod and your smart device. So these can be, and I just reinforce that there's many people out there that creating video isn't their bread and butter, that are uploading content that they've created themselves, videos that they've created themselves, and just by doing it a few times and getting familiar with it, they're able to share their content, because it's the value of the content that matters. They'll forgive a little bit of while you learn the ropes in terms of recording video, but tripod's a good spot to start. And I will hand over to questions. Nick, I might get you to call out any questions that you've had come up on the while I've been presenting, and I'll stop sharing.
Well, thank you very much for that. By the way, can you hear me, Letitia?
I can, yes, thank you.
Perfect. Thank you very much for that. So far, no questions at the moment. I was going to say, because we have run over time, I was thinking of adjourning it here, and then what we're going to do is we're going to, any follow-up questions that anyone might have, definitely the evaluation, I believe we'll have a box for that. And Letitia's handout guide will be sent out via that as well. And I believe your contact details are there as well. Am I correct in saying that? If not, they can contact you via your website.
Correct. Yes. Yeah.
Perfect.
And yeah, I didn't pop them in on the my business name is on the handout, but I haven't popped it on the handout. But by all means, it can include it on the email. And if there are follow-up, I'm conscious that the last couple of slides we did zoom through. So if there are follow-up questions, I'm happy to respond to those after tonight's session as well.
Sounds good. Well, thank you very much, Letitia. I appreciate your time, and I think everyone got quite a number of things out of that. I personally did. I mean, I don't run a practice, but anyways, you know, future plans, future plans.
This is it.
But anyways, thank you very much, everyone, for coming tonight. I am conscious of time, so thank you very much, and do fill in the evaluation surveys. Thank you.
Thank you. See you.